I'm a chronic grinder to the point that I've ground and broken several of my teeth. I'm concerned if I have implants, would they break?
They won't break. The vast majority of our patients grind their teeth. You're not the only one. That's general public too. You can't stop the grinding because it's autonomic. It's like you saying, stop blinking, stop hearing. I presume everybody grinds. So I treat everybody like they grind. So what we do is in those cases, we recommend zirconia because it's super strong, stronger than steel. And we put a titanium bar in it anyway. It's not needed. We still do it to make it super strong. Secondly, all on 4 patients get a night guard or a splint to wear, which is very thin and effective. And you can grind that instead of your teeth. But even if you were to lose that and not wear it, the bridges are super, super strong.